Hey, welcome back to Table Talk. Today we're going to talk a little bit about something that we in chiropractic don't tend to do a whole lot of, and that is what about if we need an injection? And there are different kinds of pain management that can be done. It's not usually our first go-to. Usually we're going to go the natural route. We're going to try and heal from the inside out. We're going to let the brain do the healing, and we're going to try to remove subluxation patterns, which are those blockages of the nerve as it flows out and stops the communication between the brain and wherever it is in the body, which is the end tissue. So what happens when we can't heal or can't get proper pain management? And that's when we get into the realm of maybe we need an injection. Definitely, like I said, it's not our first go-to. But there are two different types of pain management, possibly a third as well. And I'll kind of give you a little bit of the differences between the two. So half the time, here's a vertebra right here. Half the time, we're going to have maybe a disc bulge or something like that, and it's going to put pressure on that nerve right here. But in most cases, that's not always the case. You're usually going to have pain right here, and that's called the facet joint, and that's the back portion of the vertebra. So it's not actually the vertebra. It's not actually the or the front part of the vertebra. It's not that part, and it's not the disc part. It's actually the back portion. 80% of pain is coming from that. So when your doctor goes in and says, hey, you know what? Let's try and do a cortisone shot. That's where they're trying to affect. They'll put that needle in, they'll put it right there, and they'll hit that. And 80% of the time, they're going to probably be right as far as where the pain is originating from. Now, chiropractic really usually helps that problem without any drugs, without any surgery. Chiropractic does wonders on that. So for the vast majority of the time, you're probably going to be able to avoid a cortisone shot. But that is why you would use a cortisone shot, and that's why it would probably work if it did work. Okay, it'd work if it was that area. Now, we do have sometimes disc problems that are putting pressure on the nerve roots themselves, and that's not going to be enough. So sometimes your doctor will do what's called an epidural. Okay, and that's when they're going to go into the epidural space, which is actually right about here. They're actually going to go between the vertebra. So when they stick that needle in, it goes between the vertebra and it goes all the way into that little space there. Now, if they go too far, they hit the spinal cord, you could have problems. Sometimes they do it assisted, and that way they can see what's going on in there. Sometimes they just go a certain distance, and then they'll do the injection. But they're trying to get to that epidural space, so that way they can get it. And usually, instead of just hitting it locally in one spot, an epidural is going to hit above and beyond that area, which can have benefit too, especially if you have something physically pressing on a nerve. Even sometimes chiropractic's not going to be able to be enough to help that out. You have something physically hitting on a nerve, that epidural might help out quite a bit. Sometimes discectomies or laminectomies, where they kind of like remove the lamina right here and they open up the space and they just remove it on one side. Sometimes that's what they'll do. So there is where sometimes it's not within our scope of practice, and we refer out, and we would rather you go to, say, an orthopedic specialist to be able to address that. But there is the differences between an epidural and then a cortisone shot. Lastly, if the cortisone shot works, but you're still not getting a whole lot of relief, you might end up getting an ablation surgery. That's basically where they cauterize the nerve endings right here in this little space here. And that can be a benefit too, because if you have just a lot of pain and the pain's always going on, you're always going to be in that fight or flight. You're always going to be in pain. And you're not going to really be able to heal. You're not even going to be able to really maybe rest well. And so sometimes having that cauterized, if you know that is the problem, can be beneficial as well. So that is what an ablation surgery usually is trying to accomplish by doing that. The nerve roots do typically grow back over time. So just in and of itself, that's usually not enough. So you can go in there, cauterize the nerves, they will regrow over time. So if you're not really addressing the problems, not really doing the rehab, you'll end up in the same situation. So hopefully this is educational. You've gotten something out of this. Again, cortisone shots, epidurals, ablation surgeries. These are all things that not my first thing to do, but there is an option, and sometimes there's a time and place for them. Take care, guys. We'll keep giving more information.